Welcome to the presentation of the 5 health visiting mandated contacts. We know that what happens in pregnancy and early childhood impacts on physical and emotional health throughout childhood and into adult life. Children need to be ready to learn at 2 and ready for school at 5 to support foundations for good health and development, and thus the importance of supporting families in their critical years. Health visiting services are the linchpin of that support. The antenatal contact. At 28 weeks of pregnancy, a health promotion visit is offered. The antenatal contact is normally the first time that the health visitor will meet the parents, and together they will complete a family health needs assessment covering physical health, such as being smoke-free and benefits of breastfeeding, emotional health, perinatal mental health. The contact will include transition to parenthood, how parents can bond with their baby at the end of pregnancy and in the early days and help their baby's early development. The health visitor will explain the Healthy Child programme and the health visiting service to all families and identify those families who will need additional support. Kerry, one of our health visitors, would like to give the health visiting view of the antenatal contact.
Hello, my name's Kerry Armstrong and I'm a health visitor within the 0 to 19 team in Gateshead. The antenatal contact usually takes place after 28 weeks gestation or earlier if there's information to suggest that the expectant mum would benefit from our enhanced parenting pathway, which could be commenced at 20 weeks gestation. If possible, we encourage fathers to be present for this contact so that we can encourage and share health promotion and effective information to both parents. The health visitor provides parents with information about the Healthy Child programme, breastfeeding and nutrition, dental health, postnatal depression, anxiety, domestic abuse, female genital mutilation, home and car safety, crying, safe sleep, smoking cessation, vitamin requirements, and we support the expectant mum and dad with the transition to parenthood. We assess for eligibility for Healthy Start vouchers and ensure there are no reading or writing difficulties. We complete a comprehensive and holistic assessment of parents' needs and family circumstances while assessing the parental mental health and well-being of both parents. We then offer advice and support accordingly. During our antenatal contact, we commence the home assessment and environment tool, which explores where the baby will sleep at night, general living area, and where the baby's feeds and food will be prepared and stored. We support families by offering the current guidance for areas where there may be needs identified, such as safe sleep or safety.
The newborn contact. Between day 10 and 14, this will occur. The first visit made by a health visitor at home after the baby is born, where health visitors will check on the health and well-being of the parents and baby, provide support with feeding and offer issues and give important advice on keeping safe and to promote sensitive parenting. This builds on the assessment of the family risk and resilience factors started by the health visitor during the antenatal period. Specific topics including early bonding and interacting with the baby, feeding and thriving, appropriate weight gain, promotion of immunisation programme and safety will be discussed. Parents often seek advice on establishing a routine and sleep, crying and colic. Between weeks 6 and 8, a 6 to 8 week contact will be offered by the health visitor. This visit is crucial for assessing the baby's growth and well-being alongside the health of the parent, particularly looking for signs of postnatal depression. It is a key time for discussing key public health messages, including continuing with breastfeeding, immunisation, sensitive parenting, and for supporting on specific issues such as sleep. Health visitors will also review physical and emotional health, will give contact details for local networks such as children's centres. The health visitor will agree future contacts with the family, where extra help is given for issues such as perinatal mental health, feeding, and for babies with additional needs. The 9 to 12-month contact, this is a review of the child's development and will include development, growth, and immunisation status. It provides an opportunity to discuss with parents how to respond to their baby's need and link parents with their local networks. It is a vital time to discuss child safety, nutrition, and dental health. It also provides an opportunity to identify where additional support may be needed. The health visitor is able to promote the 2-year free nursery offer at both this contact and future contacts. This can improve readiness for school and help prevent disadvantaged children. The 2-year contact. The Universal 2-year review provides an opportunity both to discuss with parents how to help their growing child develop and learn, and to identify children who are not developing as expected and require additional early intervention to achieve and be ready to learn at 2 and ready for school at 5. This review is a key time when specific problems may begin to be evident, such as behavioural problems, speech and language delay. The review considers the health and development of the child alongside the wider environment of home and the family. As part of the review, health visitors will work with parents to complete the Ages and Stages questionnaire and liaise with early years settings to promote an integrated approach to assessment. The integrated review was developed to bring together health's 2-year development assessment and the early years foundation stage at 2 to assess children's development at 2 years old and identify opportunities for early intervention. By integrating the reviews, parents will receive a more complete picture of their child. If any issues are identified, this can be recognised early, ensuring interventions are timely, monitored, and make a difference to the child's outcomes. For children who do require additional support, early referrals can be completed, such as specialist services such as SEND, and the health visitors will coordinate appropriate support through team around the family or child and be an advocate for the family. Katie, one of our health visitors, would like to discuss the 2-year contact from a health visitor's perspective.
Hi, my name is Katie. I'm one of the health visitors for HJFT. The 2-year review provides an opportunity for parents to discuss their child's holistic development with an experienced health professional. A holistic approach allows not only the health and development of the child to be considered, but also wider determinants such as the home environment and family circumstances. The Ages and Stages questionnaire is utilised as part of this review to allow parents prior to the contact to complete and reflect on how their child is developing. Parental concerns or anxieties can be discussed and acted upon where necessary. Early identification of children that are developing outside of the norm is essential to be able to offer early intervention and improved outcomes. An integrated approach is taken for this review if a child is attending an early years setting where assessment information can be shared and a joint plan implemented to support the development of a child with full parental consent. As a service, time-limited packages of care can be offered to families to support children in their development.
As discussed throughout this presentation, some families require additional support. Health visitors are trained in delivering many skilled interventions and support packages. Early years practitioners can be key professionals to offer some of these interventions. Some targeted interventions offered by the 0 to 19 service are infant feeding, mental health, minor illness, accident prevention, transitions, SEND, child development, vulnerable families, safeguarding, and looked after children. Lorna and Louise are 2 of our early years practitioners who are here today to discuss their role within the 0 to 19 service.
Hi, my name is Lorna. My name is Louise. and we are early years practitioners for Gateshead 0 to 19 service. As part of the early years practitioner role, we support the 0 to 19 service with delegated workload, bringing a skill mix approach to the service. We complete targeted, time-limited work to families throughout delivering packages of care which support children's development through parental education and play skills.
Targeted work can support speech and language development,
infant feeding and breastfeeding support,
toilet training,
promoting positive routines and behaviours,
sleep support,
designed packages of care to children with additional needs,
alongside health promotion such as dental health and accident prevention. Part of our current role is to support and maintain the digital rollout of clinics using the platform Attend Anywhere. This is where parents can access the 0 to 19 service virtually and can ask advice from a practitioner. We also support where appropriate with universal co-offer contacts.
Within the 0 to 19 service, there are specialist teams. The health visitors work closely with all of the teams. And Deborah today, one of our SEND nurses, would like to present a case study to show integrated working between the health visiting service and the SEND team.
Hello everybody, my name's Deborah and I'm the SEND nurse with the Gateshead 0 to 19 team. The presentation today is regarding a young boy that I have supported, and I've changed his name to Ian just to maintain confidentiality throughout. So a referral from the health visitor came to me November 2019, and at that point Ian was 3 years and 5 months and has a diagnosis of a range of complex needs. Health visitor, while visiting the household for a younger sibling, identified that Ian was not yet using the toilet and was still relying on nappies. Due to the complexity of Ian's needs, the health visitor identified referral to SEND team would be most appropriate to support with toileting. The health visitor followed the referral pathway and added the child to our SEND referral waiting list. December 2019, I carried out a home visit, and that initial home visit gave an opportunity to introduce myself, and I recognised that a health needs assessment and home environment assessment tool had already been completed, and I reviewed that prior to the visit. Using guidance from NICE Guidelines and ERIC, which is the Children's Bowel and Bladder Charity, I discussed with Mam readiness to toilet train. Mam was willing to complete the 3-day input-output charts as part of the 0 to 19 pathway, and advice was given. As Ian had previously had a PEG tube inserted, I had to be aware and adapt fluid advice to suit his needs. So following that first visit, I sought further advice from the dietitian and the bladder and bowel service. January 2020, another home visit was carried out by myself, and I reviewed the 3-day charts and information given to me by the dietitian and the bladder and bowel service, as well as following the 0 to 19 pathway guidance. A daily fluid intake plan was formulated to achieve good bladder capacity. Mam has already started to implement the advice that I'd given on the first visit, and nappy changes are now being carried out in the bathroom alongside good hand hygiene. Mam reports that's going well. Fluid plan to commence following this visit and will then be reviewed again following the 0 to 19 service pathway. February 2020, another home visit is carried out by myself, and review of the advice given using ERIC and NICE guidelines. Mam has been able to give the recommended fluids using this advice as the recommended daily amount for the child of his age. Fluids have been given both orally and also administered through the PEG, which in turn meets his needs of the external fluid plan prescribed by the dietitian. Mam notes nappies are now dry for longer periods of time. Although toilet and support has begun to see a positive outcome, Mam has asked at this point if we can put the visits on hold, as she has had notification that Ian's PEG tube is to be removed, and due to the complexity of Ian's additional needs, Mam does not want to overwhelm at this time. So knowing that the fluid plan will no longer be in place once the PEG tube is removed, I formulated a new fluid plan that Mam would be able to begin once the PEG was removed, and that